student and faculty. I think I know most of you, and then we've met recently a few of our visitors to our program today. Today we're going to showcase our wonderful students and some really interesting internship opportunities that they've had in the last year or two. We have one of our graduates two of our graduates who are with us. Three graduates, one just as of December. And we're really excited to hear about their experiences. This is the first time we've showcased our students and their internships, so it's a fun moment for us to all get together. All right. V, would you like to introduce yourself?
Hi, everyone. I'm the coordinator of the Aging and Health program. I've been with Georgetown as a staff member since 2017, and I'm also a graduate of Georgetown University as well. You've probably received lots of emails from me. I'm usually the person that's responding to these emails from either the aging account or from my own account. So I'm V.
That's terrific. Thank you. Cassandra, will you go next? I'm just going to go around the Zoom room and call everybody and just say your name and your interest in the program or in aging. Oh, please unmute yourself.
Wrong button, my bad. I'm Cassandra. I'm graduating in May, and I'm interested in senior living administration and long-term care.
Terrific. Kamrul, will you introduce yourself briefly?
I am Dr. Kamrul Hassan Jia from Bangladesh, and I have a graduate in medical science and I have got post-graduation in forensic medicine and toxicology, and I am very much eager to learn the methods of aging and health, and I think it will help me as well as my stakeholders to be survive more value in their life, and they will get longevity in their I will work for the longevity of this great community of old aged people. Thank you.
Thank you. Michael, will you introduce yourself briefly?
Sure. Good afternoon, everyone. I'm Michael Sims. I was in the first graduate class of this program, and I'm very excited to be here. I'll be presenting on disparities in long-term care.
Thank you very much. Anne, will you introduce yourself?
Yes, hello everyone. I was in the group with Michael and Kim and Abby. It's awesome to see so many wonderful familiar faces and so many new ones. I'm teach undergraduate journalism at Georgetown, so trying to mesh the two, aging and journalism. Looking forward to seeing and hearing the presentations. Hi, Abby. Okay.
That's great. Abby, will you introduce yourself next?
Sure. Hi, everyone. It's so great to see all familiar faces and meet new ones. Hi, Anne. I am going to be presenting on my internship with AARP, which I just finished up this past December. So it's been a long internship. I guess I'm kind of a super senior intern, I guess, for that organization. But I'm currently getting my PhD at Miami in gerontology.
Great. That's terrific. Kim, will you go next?
Sure. Hi, everybody. It's nice to see some familiar faces, and it's nice to meet some new ones. I hope everybody's doing really well. My name again is Kim Redlich, and I'll be talking today about my internship with Temple University in Rome and its study abroad program for older adults, and I am in my final semester of the program.
Yay. Gail, will you go next?
I'm Gail Cohn. I'm the age-friendly DC coordinator for the district government. I work in the mayor's office. I also taught a class last summer with Pam. on age-friendly activities, which follows the social determinants of health. And a number of people today are presenting. I'm so excited to hear what they have to say.
That's right. And well, you should be teaching that class again this summer. So stay tuned, right? Dr. Friedland, would you introduce yourself?
Hello, everybody. It's great to see everyone. This is one of the great joys of teaching and I've been at Georgetown for more than 20 years, and I taught somewhere else long before that also. So it's one of the great joys is watching current students and looking at students who have graduated and hearing what they're up to. So I'm delighted to see everybody here. And I teach undergrads and grads in a variety of different programs. I'm an economist with a particular interest in health and long-term care, but I also am the director of the Healthcare Management and Policy Program, which is a program in our in the college or in the undergrad program.
Thank you so much. Nefeli, will you introduce yourself?
Yes. Hi, everybody. My name's Nefeli Antoniadis. It's great to be here. I'm so excited for these presentations. I'm a second semester student in the program with the concentration in economics and policy. So hoping to be working on my capstone this semester and through the summer, and hope to maybe graduate in the fall.
Yay. Thank you. Anna Johnson, will you go next?
Hello, everybody. I'm Anna. This is my second semester of the program. I'm on the policy and economics track. I want to get into policy and advocacy, but I'm really excited to hear these presentations, and I'm looking forward to hearing what you have to say. Thank you.
Thank you. Zoe, will you introduce yourself?
Yeah. Hi, I'm Zoe. I am a senior at Penn State. I'll be graduating this spring, and I'm interested in long-term care and health policy as well. So I'm excited for today.
Great, thank you. Lee, will you introduce yourself?
Yes, good afternoon, everyone. And first of all, Happy New Year. And it's wonderful to see all of my good friends and classmates and my new friends and classmates. So actually, like everyone else, I'm really interested in finding out how and what the internships and the capstone projects are all about. And I am in my second semester of the Aging and Health program with a focus on senior living.
It's terrific. Richard. Just need to unmute yourself.
Yeah, hi. I'm Richard Curley. I graduated from the program in May of 2020, and I have Kim and Michael and Anne and Omelu, who's busy rolling out vaccinations in Singapore, who's not here, but I was part of the original cohort. It's great to be here, and it's great to hear you guys' presentations. Thank you.
Thank you. Yoon, will you introduce yourself?
Hi, everyone. I'm Yoon. It's really nice to see everyone here today. Yeah, I'll be talking about my internship with Age-Friendly DC and Gale. So I'll be talking about the research project I did on reducing social isolation and loneliness in older adults using technology.
Thank you. Patricia, nice to see you. Will you introduce yourself?
Hi, my name is Patricia, and I'm actually in the Health and the Public Interest program, the HAPPY program at Georgetown. And kind of like Anna and Nefeli, I'm also a second semester student, and I'm looking forward to starting my capstone soon. So I'm really excited to see what everyone has to say about their presentations that they're going to talk about in the showcase.
Thank you. Katie, great to see you. Welcome. Katie is our new student who started this month. So welcome, welcome.
Yes, I literally started 4 or 5 days ago. So really excited to be here. It's been, I feel like I've learned so much already, you know, in like the 3 days that I've been able to come to class. And I guess I eventually want to get into medicine. I'd like to go to medical school, but I felt like I had so much to learn just about equity and dignity, and I think aging particularly hits on those two things, and I just have so much to learn. And I'm really excited to hear what the capstones kind of have come to and what that looks like, because I'll be looking for one soon. So
Terrific.
Your background is wonderful.
Thank you.
Thank you. Thank you. Anna Sepulveda, would you like to introduce yourself?
Yes, hello. How here in Portugal is good afternoon for all of you. Sorry for having my camera off. I'm the CEO of 40 Plus Lab. We are a small boutique consultancy company on longevity economy, but I also represent Aging 2.0 Global Network here in Portugal, and I'm the president of Age Friendly Portugal Association. I'm here to learn a little bit more, but more than that, to see what young people are doing, to see if I, who knows, bring someone of you here to Europe. So this is why I'm here. Thank you.
Very exciting. Thank you. Sonia, Professor Barsness, would you like to introduce yourself? We have one of our faculty members, Professor Barsness. I see her on the screen.
I think Dr. Barsness is, she has a migraine right now, so she won't be able to.
Oh, okay. Well,
Yeah.
Thanks for letting me know.
Yeah.
Jonathan Chafin, would you like to introduce yourself?
Sure. Good afternoon, everybody. I'm Jonathan. I'm currently working on my application for the program to hopefully start in the fall. I'm a music therapist and I currently work with older adults in assisted living. So especially looking forward to the presentation on isolation, definitely something we've struggled a lot with this last year. So just looking to see what the students are up to. Thanks so much.
Thank you. Vivian Cooper, would you like to introduce yourself?
Hi, everyone. I'm Vivian Cooper. I am currently owner of an assisted living, and I am interested in expanding my experiences and studies in the field of aging. And I have not done my application yet, and I'm looking forward to listening to everybody's presentations.
Wonderful, thank you. I see someone who's just joined us, Malika Zakmi. Would you like to just tell your name and your interest in aging? If you're able to, or if you'd like to text or chat instead, that's fine. All right, well, why don't we get started? Thank you all for being here. This is so exciting to have everybody and have such interest. Also, I'd like to express that I love seeing everybody, graduates and current students, so it's a real pleasure. I agree with Dr. Friedland. So the first on our list of presenters is Kim Redlich. Kim is a wonderful student who designed a really interesting project, which she entitles Adult Study Abroad Program, Temple University in Rome. Kim, I'm handing the controls over to you.
Sounds good, thank you. So hello again to everybody. I'm excited to be here and to talk about my internship, which took place this past fall. As Dr. Saunders mentioned, and as is listed on the email, my internship was with Temple University in Rome, and my specific job was to help them to launch an adult study abroad program for this summer. So in terms of, I guess, how I found my way there, I believe really strongly in the benefits of lifelong learning and in the transformative power of travel. And I was interested in how the merging of these two things could produce purpose and meaning for people of all ages, and especially for older adults. I think what kicked it off for me was in AGHL 502, which is the research course that is one of the mandatory courses for this program, which most of you or some of you are familiar with. I was involved in a group project about intergenerational education, and it was specifically about mixed age classrooms, about college students sharing a classroom with older adults. And as part of that project, we investigated senior audit programs. So For those of you who might be unfamiliar, senior audit programs are pretty ubiquitous at colleges and universities across the nation, small ones, large ones, public ones, and private ones. They allow older adults within a community to take undergraduate courses at a nominal fee. And for example, Georgetown has one that's called the Senior Citizen Non-Degree Auditor Program. This one or that one is for older adults age 65 and older. It costs $30 a credit, and it allows access to a vast amount and variety of undergraduate courses, both in person and now, of course, virtually online. Temple University in Philadelphia, which is where that college or university is based, also has a similar program that they call the Senior Scholars Program. That one skews a little bit younger. It's for people age 50 and older. It's a little bit more expensive, but it's the same in that it offers this vast array of undergraduate courses at a nominal fee for older adults. So Temple University in Rome is one of about maybe 30 study abroad campuses in Rome, Italy. It's one of the largest and also one of the oldest. It's going on, I think it's 55th year anniversary this coming year, and it's located in the historic center of Rome. It serves about maybe 400 to 600 undergraduate students a year, primarily in the spring, but also it has a fall semester and 2 summer semesters, which is where the abroad program comes in for older adults. So this adult study abroad program was originally conceived as an extension of Temple University in Philadelphia's Senior Scholars Program. What happened was there was one particular senior scholar whose name is Susan. She was also an alumna from the 1980s of Temple University in Rome, and she wanted to go to Rome to take 2 audit courses there. So she asked permission to do this, and they said yes. So I think she took a photography class and a history class, and she was somewhat of a pioneer. And from that, the university felt that they could really support this initiative. It was a very positive experience, both for Susan and also for the younger students with whom she shared classes. So this intergenerational aspect of the program was very interesting to them. I think the university also felt it could be another revenue stream for them. I think they feel that it's a way to reconnect alums back to the university, possibly leading to financial giving. I think from a community perspective, it was positive. And so they started to figure out how and if they could offer it in a wider way. So my internship specifically was, to my chagrin, it was remote. And I worked primarily with 2 people, one in the Philadelphia office who handles the Senior Scholars Program, and one in Rome. He was my primary contact, and among many other things, he's in charge of launching this adult study abroad program. There was no real structure, let's say, to my internship because they had not had interns before and the program itself is very new. So we sort of figured it out as we went along, which worked pretty well. Actually, I think we were able to make a success of it. And in terms of the objectives of my program, of my internship, really, I think they fell into two buckets of business research, essentially. One was market research to define the landscape, since this is so new, what else is out there? How do we begin to plan this and understand what it can look like? And secondly, consumer research, which led directly to the development of the program and enabled me to talk to many people to learn more about what might work. To a lesser degree, I was involved in meetings and discussions about how to handle the fiscal end of the program, as well as some risk management issues surrounding bringing older adults to Rome, and also discussions about developments, sort of how to create these correlations between a giving culture and the Senior Scholars Program and the Adult Study Abroad program. In terms of the market research piece, because Adult Study Abroad as a concept is really new and lives within the framework of educational travel, which is also kind of amorphous, my first job was, as I said before, to try to figure out what else was out there. The United Nations World Tourism Organization estimates today that educational travel represents about 35 to 40% of tourism, of all tourism today. So we know that it's a growing trend in general, not as applied to older adults specifically. There's not too much information on that, as I said. And what distinguishes Temple's program from others that are out there is essentially, to my mind, four things. One, the duration. It's a 6-week program, which is much longer than anything else that really exists. Number two, it's residential. It's not meant for touring. Participants are expected to come to Rome, get their apartments, and travel back and forth to school Monday through Thursdays. The third distinguishing element is that this program is meant to be very academic. So the courses are actual undergraduate courses that are rigorous, but likely even more so because they're compressed within a 6-week summer session, and they're taught by university faculty. So research tells us also that older adults who are interested in pursuing continuing education and who are fortunate enough to have the good health and the financial resources to do so are really what we call knowledge seekers. So they really want, for the most part, that kind of intensive educational experience for learning. And the fourth distinguishing factor is that Temple's study abroad program is really intergenerational, right? So it's meant to be a shared experience, and I think that gives it a very particular value. So as I looked at the sort of the market landscape and researched it, I was able to segment this category of adult educational travel into 6 buckets. I'm not gonna go through all the buckets today, but I'll highlight 2 that I think are particularly relevant. So first is other academic university programs, and these are things like Cambridge and Oxford University both have summer intensive academic residential programs, but they are not geared for older adults. So that's a big difference. The second, I think, particularly relevant category is educational tourism, which includes things like university alumni tours, Smithsonian has journeys, and National Geographic and things like that have expeditions. They're quite expensive and they're different in other ways. Within this category, the most similar one is a company called Road Scholar. It's a play on words, and road is R-O-A-D as opposed to road as like Greece. And at least in this arena, it's pretty ubiquitous. So some of you may have heard of it. It was established in 1975, and at that time, it was affiliated with, I think, 5 colleges, and it had 220 participants. And now, as a comparison, it has 5,500 educational tours. It operates in 50 states and 150 countries. And the most interesting thing about this is in the last, about 2 years ago, they introduced new programming. They now offer extended stay programs in 4 or 5 cities, one of which is Florence, Italy, where they offer a 45-day residential educational program, which is sold out for 2021. So some of these other buckets that I'm not going to talk about are things like voluntourism, programs for older adults that specialize in language learning, professional development programs, and things like that. So through this market research, I was able to identify 9 particular programs that were comparable on some level with Temple's, and that information really helped us understand what else was out there and build the program. The second type of research that I alluded to before is consumer research, and that began with one-on-one interviews with older adults. These were older adults who were either auditing courses at their local university through a similar senior scholars program, older adults who had experienced educational travel programs prior and had feelings about them that they wanted to share, and also older adults who were involved in some other type, let's say, of non-credit continuing education, like OAET programs, if some of you are familiar with those, which are led by the Osher Institute. They're a little bit different, but I captured that as well. And these interviews form the basis for topics that I would later embed into 2 surveys. So prior to releasing these 2 surveys in November, Dr. Saunders, who was a great help to me through this process, made a wise recommendation that I find and recruit some people to work with me as survey testers to provide feedback about elements of the survey that either they found confusing or ambiguous, or they thought I left out some topics. There were things they were interested in that they didn't see, and so on. So we went ahead with that, and then we were able to really refine the questions and revamp the surveys themselves, the organization of them, as well as the content. We released the first survey in the beginning of November to the senior scholars at Temple University in Philadelphia, which is about 320 people, and we got 48 responses. And we released a second survey at the end of the month to 7,000 people who were part of the Temple and Rome mailing list from the 1970s until today. So that group wasn't as targeted because they included more recent alumni as well. We asked about sort of basic things that, you know, like age and employment status and university affiliation, but we also asked about feelings that respondents might have regarding being in an intergenerational classroom, what concerns they had about their health. Maybe COVID came up a lot, thoughts about pricing, time commitment, and so on and so forth. And these results allowed us to build a program that we really hope will be met with a lot of success. So in December, we presented the dean with our findings, and we held a virtual information session with alumni from Temple, the Senior Scholars Program, and other interested parties. And right now we're really just waiting to hear about the timing. So in conclusion, you know, overall, I believe strongly that there's a significant opportunity in this area, especially given that the idea of senior scholars or senior travelers are increasingly accounting for a larger share of global vacation spending overall. And I've seen recently that universities like Georgia Tech and Stanford University has a Loop program that they've initiated. A lot of universities, or not a lot, but several universities have recently announced these initiatives regarding lifelong learning. And I feel that not only the universities themselves, but students of all ages and communities do stand to benefit from encouraging students to keep learning throughout the life course and to keep expanding their horizons. So that's my presentation for today. Thank you all for listening.
Thank you so much, Kim. That was great. I will open it up to questions from the group.
I had a question, Kim.
I recognize that voice. Hi, Richard.
Hi, how you doing? The response rate for the second group you mentioned, you said there were 7,000 that you sent a survey to. Did I get that right?
That is true.
What was the response rate from that group? I'm just curious.
So the response rate from the first group, which was specifically 316, I think, people, and we got 47 responses back, was pretty decent. The response from the second group of people was abysmal, Richard. It went out on Thanksgiving, which
Yeah.
was obviously a mistake, but it was the only slot that was open on the university calendar. And we really didn't get a lot of good data at all from that second survey.
Okay. Well, usually mail-out surveys don't result in huge response rates anyways. But of course, when you were dealing with the academic people, you're apt to get a higher one. 48% is an amazingly good response rate. But even if you got 10% out of the second group, that would still have been a relatively decent response rate. So I don't know what you got.
If only, yeah, nowhere near 10%. And the first group wasn't 48%. It was, I think, 47 out of 316. So it's still, I mean, it's still an acceptable number. I think we were happy with that, but not so for the second group.
Yeah, that'd be interesting if you targeted that group again in a better time, just to see if you got a better response rate.
Yes, that was my suggestion as well.
Yeah.
Thank you.
So it looks like Gail has a question. Would you comment on age-friendly universities, which is a fast-growing international movement?
For sure. I spoke to a few people that were that are involved in that movement in Ireland, mostly because I think that's where it's based. They, you know, their model is a little bit different. As I think, Gail, you're probably very familiar. The age-friendly university movement is primarily focused on making universities across the world more friendly to people of all ages. So the way in which that dovetailed with my particular internship is I have encouraged Temple University in Rome to apply for that status. And I started to assist them in looking at the criteria that are necessary for them to have that status. And I hope that, you know, I hope they move forward with that because I think it's great.
So it looks like we have another 2 questions in the chat, and then we'll go on to the next. Jonathan Chafin wants to know if there was a set curricula for the 6 weeks for the Rome program, or did students choose their own courses? And then Lee would like to know the number of items on your survey.
Okay, so in answer to the first question, right now the way the program looks is that each participant has the option to choose whatever courses are offered during the semester they're there. And there are quite a few courses offered in history, in art, in literature. There's some economics classes, there's some political science classes. So the participant can choose whatever he or she prefers to study while there. And then there's the option beyond that to choose a class that is more of a survey class that is specifically for the older adult cohort, which incorporates a lot of experiential learning across the city of Rome. So in a given week, there's one class in the classroom followed by a visit to either a site, a cultural site, architectural site, a museum, and so on. I hope that answers your question. Okay. Sorry, Dr. Saunders, the second question was?
The number of items on your survey.
So for our initial survey, I'll tell you because I don't remember. There were 27 items. And that included contact information at the end. So that added maybe 3 or 4. And for our second survey, there were 31.
Perfect. And I see that Nefeli has a question. Nefeli, I hope you don't mind if I ask you to direct that question to Kim maybe afterwards, and if we get through some of the other presentations. Terrific. So our next speaker will be Yoon Kim. Yoon just graduated in December, and I'd like to take a moment for everybody to clap and congratulate for our very, very newest graduate. Very, very exciting, and she did a wonderful job. Yoon will talk about the effect of technology use in reducing social isolation or loneliness in older adults. I was honored to be part of this project, and Yoon was able to present this at the Gerontological Society of America meetings in an online poster session. She submitted for the late breaker poster session and was accepted. So we are very proud of her for that initiative. So Yoon, I'm gonna turn it over to you.
Okay, thank you. Should I share my screen?
Please.
Yeah, okay. So yeah, hi everyone. I recently graduated, so it's been like a month since I graduated from the program. And so I did my internship in the summer of 2020 from May to August 7th, I think it was, with Age Friendly DC. And we have Gail here with us. She was the coordinator of, she is the coordinator of Age Friendly DC, and she was my preceptor. And during my internship, because everything was virtual, I didn't get to go on site, but I did get to do a research project on the effect of technology use in reducing social isolation and loneliness in older adults. So today, I think I'll be going over the processes of writing a review article and maybe providing some tips to how to do kind of like a research project or work on a research paper during your capstone. So let me, so to tell you briefly about Age Friendly DC, if you take the Aging in Place course during the summer, you'll learn much more about it from Gail. But to go over it briefly, Age Friendly DC is part of an international effort by the World Health Organization to address demographic changes of population aging and rapid urbanization. And in the United States, AARP is a key agent for the WHO, and it leads a network of age-friendly communities. I think there are about more than 400 age-friendly communities in the US. And Age Friendly DC aims to make an environment for everyone, for people of all ages to stay active, healthy, and connected in the city. And the initiative is led by the Office of Deputy Mayor for Health and Human Services. And Age Friendly DC was recognized and awarded as a top city in the world by the WHO and AARP in 2017. This kind of gives you like a glimpse of the age-friendly cities worldwide. So there are more than 1,000 cities and communities in 44 countries covering 262 million people worldwide. And I think it is currently expanding as well. So there are many more countries and communities and cities that are joining the global network for age-friendly cities. And so during going on to my research paper, because of COVID and because we had to work remotely, Gail suggested that I work on a research paper. And in the first week of my internship, I had to select a topic. So I submitted a few research topics that I was interested in. And finally, we decided on looking at the effect of technology use in reducing social isolation and loneliness in older adults. Because of COVID and the pandemic, I think I was curious at the time and currently as well, how older adults are coping during a pandemic when everything has to be done virtually online using technological devices. And older adults might not be as they might find it harder than younger adults to adapt to new technologies and use the internet. And they might not have access to the internet. So I was wondering how technology could be promoted to reduce social isolation and loneliness during a pandemic in particular. And in doing that, because I had to look at some of the journals in aging and health and get to know what journals there are in gerontology. And as we all know, the gerontologist is at the top of the list. So I went into that website and their website and looked at the type of review articles that they would be accepting for publication. And I found that they only accepted review articles, state-of-the-art review articles, which were systematic reviews, scoping review, and umbrella reviews. So these are very rigorous and comprehensive kind of search strategy review articles. So I had to get to know the processes and the protocols for systematic review. And I think when you are thinking about writing a research paper, you could be doing like quantitative analysis using surveys or secondary data sets, or you could be doing focus groups and in-depth interviews, which would be qualitative analysis. And or you could be doing a review article like me, which could, I think, build kind of a solid foundation for your for the topic of your interest. So that was really good methodology for me. And because I was studying the different kinds of reviewer typologies, there are many, and these are just some of the few, some of the ones that many journals like to accept. So I won't go over this too much. You can kind of find information on this in the internet and on through the library. And I wanted to say using the library resources helped me very much in doing my systematic review, because once you graduate from the program, you lose access to the electronic databases. So I suggest while you are enrolled in the program as a student, you make full use of the databases and library resources. And also consulting with librarians was very helpful, because they kind of guided me through the processes of systematic review. So like using the chat function and sending them email with like specific questions and like research information and the methodology that you want to be using, I think would help them direct you to the appropriate librarian. I worked with a senior librarian from the Dahlgren Memorial Library, which is, I think, the medical center library. So she was very helpful in helping me find the search strategies and helping me find the resources for this paper. And also using RefWorks and Zotero and things like that, the citation manager helps you save time as well. And because systematic review was a collaborative effort, it involves a team of researchers going through each article, kind of reviewing it and screening it and voting for it. I made use of Google Sheets and Docs, which was very convenient. So using these platforms, I think, helps a lot with the research. And so finally, this is the poster that I presented at the Gerontological Society of America. Because I think if you are interested, if any of you are interested in going on to advanced degrees or going on to a doctoral program, I think they are looking for people with research experience, and having kind of like a capstone project or having a poster, I think kind of demonstrates that you have been working on research and have the research skill set while doing that. So I found that because I'm applying to a few doctoral programs right now in gerontology, I find that when I'm communicating with the faculty members, they are very much interested in this topic and the fact that I have a poster that I presented. So I think gaining these kind of skill set through research projects would be helpful if you are interested in doing research going forward. And so I don't know if I have time to go over my poster in detail. So I'll briefly do that. I used 7 databases to look for search terms that were related to social isolation, loneliness, older adults, and technology. And this search kind of found 1,443 citations and abstracts. So that is a lot, but a lot of it, around 600 were duplicates. So I removed that using RefWorks and Ryan, which are like the software that you can use. And then I had around 770 citation and abstracts, which I had to kind of skim through and see whether they were relevant. So I did that. And then I came down to 59 full text articles, which we had like 5 team members in our group. So we were reviewing each article independently and then voting whether to include or exclude it. So we went through that process and came down to 38 studies included in the synthesis of our paper. And going on to the eligibility criteria for study selection. So we included articles that looked at the empirical evidence on the relationship or the effect of using technology to reduce social isolation or loneliness in adults over 50. And we looked at articles published in English between 2010 and June 2020 and examined the social isolation or loneliness as an outcome. So we had to exclude articles that were like opinion pieces, conceptual papers, and case studies or pilot studies or feasibility studies. And also we excluded articles that looked at loneliness or social isolation as like a mediator or a moderator. So looking at the results of the 38 studies that were included in the synthesis, we could see that there were an increase in the number of articles in the past few years. Like in 2019 and 2020, there are many more articles included in our synthesis. And also looking at the study types, 26 was quantitative analysis and 11 were qualitative. So there were many more quantitative studies. And also looking at the study design, around 18 were experimental intervention studies, while 20 were observational studies. And looking at the number of articles by continent, most articles were published in North America or Europe, and a few in Asia, Oceania, and Africa. And looking at the results, a majority of the findings reported that technology use and social isolation or loneliness were negatively associated, which means that if you use more technology, you're more likely to be less lonely or isolated. But there were some studies that reported non-significant findings, as well as a few that reported positive correlation between the two. And some of the things that we found while reading through the articles was that there were some barriers that were identified, like not having access to the internet and not being able to use devices well. So there were discussions about how age-friendly devices should be developed, and also increasing the access to internet and Wi-Fi. So these were the preliminary results that I presented at the annual conference of GSA. And we are still working on this project paper because we have to go through the appraisal part of it, which is using appraisal tools to assess the quality of each article. So we are working on that right now. And hopefully when it's done and when everything is written up, I think we should be able to submit it somewhere and have it published within this year, hopefully. So that's it from me. If you have any questions, please ask them right now, or you can email me. And thank you for your attention.
Thank you, Yun. That was wonderful. I opened it up for questions from the group.
Yeah, I have a question, Yoon. Did you see any indication that the problem was more profound and more significant in rural areas in the United States than in urban ones? Because I would expect that connectivity in rural areas, and this is one of the problems I think they're trying to tackle now in some respects, is much more pronounced than it is in more urban areas in the U.S.
Yes, I think there was some comments about rural areas not having the access to the internet in some of the discussions. And also I think there was like a study in Israel that kind of looked at the urban area versus a rural area that had like an interesting finding as well. So yeah, I think being in a rural area can increase the barriers to access to the internet and devices.
So as a matter of policy, it would make sense to promote at whatever level the notion that it would be extremely beneficial to the older adult population if we could increase connectivity in these more rural areas.
Right.
As soon as possible.
Right.
Thank you.
Thank you, Richard. We have a couple questions on the chat. Nefeli is interested in knowing what your biggest takeaways or what surprised you from your research.
Yeah, so some of the some of the findings showed positive relationship between the internet use and loneliness. So I think some of the people who are more lonely tend to use more internet. And so some of the things and findings like that we didn't expect, but because this kind of correlation doesn't kind of give you the causal effect. So I think that was something that I found interesting. And because we looked at different studies from different countries as well, it was interesting to see that most of the studies were from Europe and North America, because I think it was because we looked at studies in English, but having some having some studies from Africa and Asia and China and things like that, I think it was good to see the differences in some cultures. Yeah.
That's great. I'm sorry if I can't get to everybody's question. Here's one more from Gail. Gail says, in DC, there are more 50 plus individuals becoming more facile with tech as a result of COVID. Do you hypothesize that looking at COVID as a catalyst will increase internet connectivity?
Yes, I think because of COVID, everyone's getting more used to using the internet. I myself, I think, is more adapting to different kinds of platforms. And I mean, once you have once you become exposed to the internet and kind of use it frequently, I think age doesn't really matter. It becomes much more easier to adopt new technologies. But I think there is a barrier at the beginning of kind of going into that phase of kind of getting used to it. And I think because of COVID, everyone has been using the internet much more, like using Zoom and FaceTime to connect with people. So I think that's kind of the positive side of this pandemic. Everyone getting used to technology and virtually connecting more.
Very interesting. So I apologize for the other questions. I'm going to continue now because we have two more presenters. Our next presenter will be Michael Sims. He was in the first graduating class of the program in Aging and Health, and we are very proud of him for that. He did a project with Professor John Haga, so some of you are taking classes with right now. The title of his presentation is Health Disparities in Long-Term Care in the U.S. So, Michael, I turn it over to you.
Thank you so much for having me. It's great to be here. Okay, so I'm going to share my screen. Actually. All right. So yes, as Dr. Saunders mentioned, this project sprung from an internship where I was investigating health disparities in long-term care in the US. and I was reaching out to leaders in government, private industry, and conducting research with the help of librarians and online. So health disparities, what are they, right? So I'm going to begin in referencing an article. So physician and professor of family community medicine, Paula Braveman, published in 2014, a very helpful guide to understanding health disparities. She made several distinctions between the terms, or among the terms, health inequalities, health inequity, and health disparity. And she alerts us to the definition of health disparity since the coinage of the term around 1990. So given that the term health disparity, according to Braveman, was not intended to denote all possible variances among all thinkable groups of people. Take, for instance, differences in health outcomes between two groups of affluent people, or even the worst health among the elderly compared with young adults. Those are merely differences. Disparities then at their core, as opposed to the two previous examples of differences, reveal concerns about social justice, even when their causes are yet unknown. Disparities highlight occasions when an already economically and socially disadvantaged group experiences further disadvantage with respect to their health. This further disadvantage can also be of particular concern given the indispensable role of health in overcoming economic and social disadvantage. So, facilitating lives that are as healthy and engaged as possible is one of the most important and widely professed goals of any society. When we're young and healthy, such a life can seem so simple that we hardly think about it. And when we're sick, frail, or disabled, this standard can become a challenge. So the long-term care system, I put system in quotes, the overall system of support for long-term care is actually a mix-up of arrangements with no single overarching regulatory structure. There are indeed two systems of long-term care, one being unpaid family and friends and paid assistance. So the family and friends system is the largest, as many of us could know from personal experience. And it also places significant strain on caregivers whom we as a nation do very little to support. Paid assistance involves a number of pieces, including Medicaid, whose rules vary across states and among a variety of sub-programs. And while Medicare does not pay for extended long-term care, it does cover home and nursing home care 90 days after a hospital discharge. So it's, in a way, part of the system. Assisted living is also, in a way, part of the system, as it has emerged as an alternative to the paid assistance in nursing homes, although it's arguably of a more residential than institutional nature. So today, I'll aim to explore several health disparities with respect to race, socioeconomic status, and geography in three settings: nursing homes, home and community-based services, and assisted living. And then I'll offer a few policy suggestions at the end. Nursing homes. So since the Institute of Medicine's 1981 report citing racial segregation in US nursing homes as a hurdle to the effectual delivery of long-term care services, there's been continued, though limited, research supporting the notion that such a disparity exists. even as the nature of the disparity has shifted over the past few decades. And we'll get to that later when we talk about assisted living. Some data have supported the idea that the institutional segregation of nursing homes mirrors the residential segregation in respective communities. And even in light of these patterns, there are, even while considering arguments in favor of consumer choice, concerns about access to quality nursing home care. Current scholarship suggests that while racial minorities may not face overt discrimination from being admitted into certain nursing homes, the business decisions of nursing home providers and potential clients' preferences based on geographical proximity lend a health disparity likely rooted in institutional racism, and further research is needed to explore where these trends are influenced more by either compositional or contextual factors. So, socioeconomic status, Medicaid payment schedules greatly influence the disparities found in the nursing home world. And as nursing homes aim to have greater revenues, they therefore seek to attract Medicare and private pay clients. And with Medicaid rates being lower than Medicare rates and significantly lower than the prices charged for private pay clients, there exists de facto socioeconomic segregation. Geography, rural urban disparities. So it's been found, it's been reported that the residents of rural nursing homes tend to have greater physical functioning than the residents of urban nursing homes. And even still, rural residents nonetheless face disparities relative to their urban counterparts. Such disparities are largely attributable to rural nursing homes' relatively lower degree of adequate staffing and rural nursing homes' greater reliance on Medicaid. So unlike urban nursing homes, whose larger facilities and nursing home chain membership can produce greater numbers of specialized staff, and whose expenses are better absorbed by greater economies of scale, as the costs of specialized staff are spread out across a larger number of residents. Rural facilities tend to be smaller, and while demand for nursing home care is higher in rural areas on a per capita basis, the overall demand is lower, given rural areas' smaller population. HCBS. Medicaid home and community-based services serve as a particular sort of long-term support services, LTSS, that bolster aging and or disabled individuals and their families with a range of provisions in a home setting, with such services as nursing, personal care, and home-delivered meals. HCBS provide for people across racial and ethnic groups. And research investigating disparities in HCBS among racial and ethnic minorities is wanting. Although, in a recent study which explored HCBS usage among individuals living with multiple sclerosis, there were data which gave credence to the view that racial disparities in HCBS usage do exist. As for example, Black men had the lowest Medicaid HCBS expenditures, while white men had the highest. This evidence is especially curious and illuminating potential areas for further study in light of multiple sclerosis being a disease which disproportionately impacts African Americans. Recent research on the cost efficiency of Medicaid long-term support services reveals that increasing HCBS targeted at high-need populations would improve efficiency. Although countering this evidence is the notion that escalating costs in Medicaid expenditures for LTSS would have the woodwork effect to blame. So the HCBS woodwork effect would mean that individuals who are presumed to not be in greatest need of the services would apparently come out of the woodwork and readily take up services that would stave off their being institutionalized. In another recent study that investigated the effect of HCBS among low-income dual-eligible older adults, the effect of HCBS alone, and so HCBS alone in this context means HCBS being provided exclusive of considering the provision of other supports. So the researchers observed that high hospitalization rates of users of HCBS alone may signal the need to address concerns of a more profound nature. So if indeed high hospitalization rates among users of HCBS alone are the result of HCBS's insufficiency, this begs the question as to whether HCBS packages may have yet missing features. Features which could have HCBS become a true alternative to nursing facility care without resulting in adverse outcomes. So such enhancement would necessarily involve increased attention to caregiver support, which is currently lacking. The extent to which Medicaid programs cover HCBS varies by state, and even such initiatives as Money Follows the Person have supported the transition of eligible individuals seeking to move from institutional settings back to the community. Even with the Money Follows the Person data, there remains to be seen to what degree disparities in HCBS with respect to geography exist, particularly in a context where HCBS programs that had been previously managed by state and local level nonprofit aging networks are now being overseen by for-profit HMOs who are mostly administered by large insurance companies. Assisted living, the shift in the nature of health disparity experienced by racial and ethnic minorities with respect to nursing home admissions is very much tied to the emergence of the assisted living market and to the accumulated historical challenges of long-term care in the US. Growing numbers of racial and ethnic minorities in nursing homes have indeed signaled an elusive pursuit of equity, as the long-term care market has developed into a two-tiered system, with Blacks and Hispanics occupying the lower tier, largely in lower quality nursing homes, and whites occupying the upper tier, mainly in assisted living. I have it that certain groups of people have managed in large part to either transcend or fall victim to the evident holdovers of the mindset concerning indigent care from the early 1900s. The mindset being that if support for long-term care could be made sufficiently punitive and stigmatizing, only the most desperate would seek assistance. Indeed, an almost exact countermeasure to the perceived woodwork effect. As concerns socioeconomic status, the nature of the two-tiered system is not only racial, but also economic. And given Medicare's adoption of prospective payment methods that lessened the incentives for providing institutional care for less medically complex patients, the market for alternatives to nursing home care, which helped foster the attractiveness of assisted living developments, came into being. Relative to nursing homes, assisted living developments provide or they service a greater proportion of Medicare and private pay clients, which also produces a level of de facto economic segregation. And there is a current lack of research addressing geographic disparities in assisted living. So this next slide, actually, in the middle, is something of an addendum to my original research on this topic, given a leaning I had during the time of the internship and a curiosity that I followed up on in the time since. So we're well aware of the dilemma for those who are neither poor enough to qualify for Medicaid or are wealthy enough to pay out of pocket or for private long-term care insurance. And if you are among the very many in the middle, you're therefore either on your own or motivated to somehow meet Medicaid coverage by spending down, for instance. And it's for that reason I have the image of the Rolls Royce, because they're anecdotal stories of people buying a Rolls Royce so as to get on Medicaid. Recent economic research, though, is showing evidence that Medicaid is crowding out private long-term care insurance, which suggests that individuals whose income and assets are non-trivially higher than the nominal Medicaid limits are nevertheless expecting to find their way onto Medicaid. It is therefore evident that individuals whose demographic information is beyond the original scope of long-term services and supports legislation, and whose profile is not often painted in conversations about this topic, are nevertheless finding this need, arguably at the expense of those who are in greater need. This raises important questions, especially in light of the aging baby boom generation and the likely sustainable advantages of being more forthcoming. Given that the US is due to have a significant increase in the number of middle-income seniors by 2029, we need a significant shift in policies surrounding long-term care. Currently and historically, Medicare does not substantially cover seniors' housing or long-term care services. And one proposed direction is to expand Medicaid by eliminating or reducing the income and asset eligibility test. As concerns a greater attention to reducing racial disparities, it is worth noting the trend in the United States of greater political will to address economic disparity than racial disparity, specifically as there exists significant pushback from a contingent, a sector from among the individuals who stand to benefit from support with healthcare and a social safety net, on the grounds that such pushback is caught up in their identity. Even as the moral culture of the US, especially over the last few decades, has seen the market as the true arbiter of value, greater awareness of the presence of health disparities with respect to race, socioeconomic status, and geography, particularly for the oldest citizens, the most vulnerable citizens, may incite an attention to their being addressed, if only for the potential of reducing the urge to game the system, which can provide an ultimate reduction of costs and strengthening of community. Thank you.
Michael, that was terrific. We have about 15 minutes left. Abby, how much time do you need?
It shouldn't be that long. I have some slides, but I'm just talking about my internship experience. So
okay, so let's give about 2 minutes for questions for Michael. I see one from Gail in the chat. She asked, do you foresee that this national Medicaid program will have an impact on, let me start from the beginning. In DC, money follows the person. Has, in a program, I guess, Care My Way, has increased reimbursement for services, which has caused growth in use by qualified persons with disabilities and older adults. Do you foresee that this national Medicaid program will have an impact on your policy recommendations?
Yeah.
Sims.
Well, I find prompted by this question an opportunity to state what I have to be my core beliefs, namely that the best policies can only make true difference in a space where we're being our best selves. And especially as it concerns the nature of this program, as we have conversations about social justice and how we go about treating the people who are frail, people who are open to receiving support. We stand the chance at taking a look. Yes, and I guess to more closely answer what is being posed by this question, taking a look at where people are going, where the money follows the person, is of use. And ultimately, it's going to require a shift in how we frame incentives.
Thank you, Michael. I know that this could be a very long conversation, and I encourage everyone to reach out to you, or we can have another chat. I do want to give Abby some time. So Abby, I'd like to turn it over for you for our final presentation. Abby was graduated, what was it, 2019?
Yep.
And she's going to be talking about her project at AARP and caregiving in the health division. So take it away.
Hi, everyone. So I started in May at AARP, May of 2019. And then I just ended almost a year and 6 months later because they kept extending my internship. And it was a paid internship, so I'm very thankful for that. So a few common misconceptions about AARP was that, no, you do not have to be a member to utilize the resources that are created. No, it's not just insurance, and no, you are not too young to work at AARP. I started at 22, so I got that question a lot. But a little background about AARP first is that it's a nonprofit, nonpartisan organization that empowers people to choose how they live as they age. It was founded in 1958, and it covers important issues like economic security, healthcare, affordable care, quality care, caregiving, and livable communities. There are 3 divisions. So I was in the programs division, but they also have their foundation, which is legal, and they have their innovation team and their products. So I was in the CSN programs division with the caregiving and health. And so we worked on supporting the 53 million family caregivers in the US who provide unpaid care. And this number jumped up by almost 10 million since 2015. So I worked on developing resources, connecting with other organizations to build these resources. And I really specialized helping my boss, Trisha, work with employers to create a caregiving culture to allow them to thrive and their workers who are family caregivers to thrive. This would be with recruitment, retention, forming policies for flexible work time. And this is really important, especially due to the pandemic with everyone working at home. Now 1 in 3 people become caregivers overnight due to the pandemic. So this flexibility and resources that we've provided to employers has been extremely beneficial. And numbers have definitely risen with who has been utilizing the products lately. So here are a few of the contributions that I made throughout my time at AARP. I kind of have broken it down into pre-COVID when I was able to go into the office, and then in the middle of the pandemic where everything was online. I feel like AARP was really able to do a good job with that because they already had caregiving policies in place where people would only work in the office a couple times a week and would actually telecommute from home the other parts of the week. So one of my favorites was the supporting military caregivers in the workforce task force. Also the summit and the toolkit. Here, this is at almost the beginning of my internship. We had a task force of organizations come in from all over. It included people from Amazon, Uber, American Airlines, United Way. They came together to really discuss policies that they had in place for military caregivers and veterans, and challenges that they were facing in the workforce. They know what could be done, what could be there to help their employees. And so we used that task force to create a toolkit. And then we had a summit that was held at the museum. And this was, we partnered with Hiring Our Heroes and the Elizabeth Dole Foundation. Care to Talk conversation cards, they are pictured on the screen. And these were cards that I actually helped kind of create. And they were about having that hard conversation with family members and caregivers and their loved ones of end of life wishes, how they would want their funeral plans to be, any other end of life decisions that you don't normally discuss because they're difficult. And then once COVID hit, our focus shifted a lot where we started having to make and create tip sheets for caregivers about nursing home issues, questions to ask, self-care, everything related to COVID. Very fascinating, especially at the beginning when no one had a lot of information yet. We still had to create the information for everyone. A very, I feel like, special and impactful moment was when I was able to screen the weekly teletown halls that AARP hosted, which 40,000 people would attend, and people would call in and ask their questions and talk about their stories with COVID, and I would get to listen and then refer their questions in. And it was very heartbreaking, very moving, but very impactful. So those are some of my favorite things that I worked on throughout my career there. And here are some slides of that summit that I was talking about. And Dr. Saunders and I were actually able to meet Senator Elizabeth Dole. So here are us featured at the bottom here. It was definitely a highlight. And then here are some of the resources that I helped create or edit. Definitely worked to collaborate with different parts of the organization. And so if you go to aarp.org/employer caregiving, all of these resources are free. So on the right, you can see the tip sheets, one of the tip sheets. I think there are over 25 of different topics. You can see there's the military workbook right here, resources for small businesses and caregiving. So just a bunch of different resources that are extremely important that I recommend everyone checking out and giving to family members. And I feel like a lot of people don't know that they're out there, but they're really great sources. So some transferable skills acquired from my internship, I would definitely say networking. I was able to meet so many people from different organizations across not just the aging field, but just businesses in general, which will need to use people like us, gerontologists, to create their products, to understand their employees. Definitely communication when I was in the office, but also just online through online meetings, task delegation. There's always a lot going on, balancing my internship as well as still going to school. It was a lot, but I was able to balance everything. And a lot of my paper topics stemmed from what I was doing at AARP. And just awareness, everyone in that organization, shared the same goals, even though they were from all different areas of life, different backgrounds, different specializations at the company, but everyone came together just to create that common awareness to help those aging. And so compatibility with AARP, I would say my mission and goals aligned like exactly with that organization. You know, I felt like I was making an impact every day. It was extremely innovative place to work, even online, but especially when I went into the office, they were always doing new things, very collaborative environment, very new, very modern. I was able to actually access their virtual reality glasses for a class and rent them out and use them, which was amazing. Adaptability with COVID, you know, they were still able to do everything they needed to get done no matter what. And my team, I can't say enough positive things about my team. They allowed me to be flexible with my class schedule, and if I had exams, they just continued. They allowed me to work, to add in hours. So I was able to work 25 hours when I first started. Then I became a full-time employee. And then once I started classes for my PhD, they allowed me to be flexible and just work whenever I wanted to, just added more hours. So my team was amazing every step of the way. And I feel like everyone at AARP is like that. They really value my input from the gerontological viewpoint, for my classes at Georgetown. They valued me, in my opinion, and I was able to utilize that. So they're really appreciative to have someone specific in that field intern there. And so if you have any questions at all about my intern experience or how do you apply or what division you want to work in, you can contact me and my email is on the screen. And if not, Dr. Saunders can give it to you as well.
Absolutely. Thank you very much. That's very exciting. And I can't believe they kept you on for so long, but I'm sure they got their money's worth. And we have about 3 minutes left. Any questions for Abby? We have one on the screen from Katie and one from Gail. Katie, do you want to say your question out loud? Katie Roberts.
I was just, first of all, thank you for presenting. That was really interesting. And I'm just curious how you think we can like mass communicate these types of resources to, you know, all the caregivers out there who may not know just the services at AARP. I know I experienced a similar thing when I interned at Livestrong. It's like you want to tell people what, you know, is out there, but how do you think we can best do that? And then do you think that the nonprofit sphere is the most effective sphere of influence for caregiving, or do you think there's a more systemic solution?
Yeah, so I know that's a major problem that like AARP always talks about, is that just not everyone is aware about the free resources that they offer, you know, due to the you know, misconceptions that AARP has. But I honestly think just social media, getting it out there that way, people sharing it, you know, offering the resources in places where people can go, like doctors' offices and support groups and just places like that. So caregivers know, you know, there are places, there are groups for them, support for them out there, and they're not alone. And I think you don't need the nonprofit, you know, to make an impact, but AARP is so well known and has so many resources now, members and connections. I feel like they're able to make an impact that way. But I mean, I'm not saying that you can't in another avenue. Other, you know, private organizations are able to do that too. But I think it's AARP's name and influence that allows them to be effective.
Thank you.
Thank you very much. There's one question from Gail. It says, DC has paid family leave. 1,300 used that program between July and September 2020. Do you see paid leave growing as a program?
So I did a paper on paid FMLA, which would be like paid family leave. And originally it started with 6. And I know DC started with that 6 states had implemented that. I think it's up to 10 now. So it's very slow, and they would take a little bit out of the money you make. So your payroll, it'd be like a little payroll tax on the individual. And it would create a fund, almost like Social Security in a way, and they would utilize it that way. I know Pennsylvania was starting to do that. It went through Congress. It was not passed. I think it'd be very beneficial. You know, there's that quote from Rosalind Carter that says, you know, if you're not a caregiver, you will be, if or you know someone who will be, or you will need the care. So I think if it was about maybe $300 a year total that they would take from your payroll tax into that fund. But with the number of people increasing, the number of caregivers increasing and those needing care, I think it would be well worth it to, to have that policy implemented. It's just getting everyone on board to do that.
That's tremendous. Thank you so much. Well, I really want to thank our presenters. Just such a wonderful job. You guys are rock stars and do a wonderful job representing us in the community. And I would love it if our current students or prospective students are interested in learning more. Let me or V know and we can connect you with these terrific presenters. Again, I want to congratulate our newest graduate in December, since we didn't get a chance to celebrate her before. Yoon Kim joins the ranks of our graduates. So thank you all for being here for our first annual student internship showcase. Hopefully we will be doing this every year to highlight our wonderful accomplished students. We've been on the phone for a while now, so I'm going to let you go. And I hope everybody has a wonderful weekend. Take care. Thank you.